I think it's really helpful to have colleagues to discuss these patients with and to share the load. And I think it really helps to be able to share with our colleagues our difficulties, because sometimes it can be quite lonely.
Medicine's a team sport, and we do need to seek out others to help us. And there always is the challenge of the siloing, that overcoming that can be difficult, but you've got to have friends.
Hi, this is Connect, Pause and Reflect, CPR for clinicians. In this series, we hear from paediatric clinicians from across Australia who joined us as part of a 4-year research project to share their reflections on the experience of delivering care for complex patients. Our hope is that their shared reflections may help others to feel empowered, more connected, and able to appreciate how they make a difference to patients and families and what sustains them in the many challenges they face. The focus of today's episode is reflection and connection. In the first half of today's podcast, clinicians discuss the value and need for connecting and reflecting, particularly for isolated clinicians, while also acknowledging that reflective practice opportunities for medical practitioners are often lacking. In the second half of today's episode, clinicians reflect on the critical importance of making reflective sessions psychologically safe and of proactively developing a culture that fosters mutual respect, trust, and safety in the workplace. Up first, clinicians discuss their recent experiences of participating in reflective sessions and the goals and benefits of reflecting and connecting.
I was thinking this morning about how great these discussions and workshops have been. I guess I was trying to reflect on what's been so useful about these discussions. I think one of the things that has been so helpful to me about this process is that it gives you a sense of permission that you can voice these things whilst still being committed to being an excellent clinician. And I think that's quite rare. So I think that having leaders who can champion this kind of process that are already leaders in their disciplines and professions is very essential.
This is what I hear those coming up, and this is what they would want. They would want to be able to have some space to sit, to ask the questions, to debrief, to listen to us talk about our challenges and how we've approached it. Some of it's learned by doing, some of it's just learned by witnessing what we do on a day-by-day basis. I think that's what's the beauty of the hospital training environment.
So it's not really about the clinical case or how you managed it, but reflecting on how that case affected you on more of an emotional level and honouring that feeling and giving it space.
I found it interesting that after the workshops that I participated in, that a common comment made was this was one of the very few forums in which there wasn't competitiveness. It was not one-upmanship, but as the facilitator said, one-downmanship. People were prepared to express honestly their vulnerabilities, in contrast to many medical meetings where there is a feeling of outsmarting, etc., which is not helpful.
Yeah, I think people used to hide it a lot. Like there was a lot of, oh, I'm coping, I can do everything. And so you think everybody's doing everything, but actually, you know, we do need forums like this so people understand.
We have so many common threads and problems, and yet we don't have common mechanisms and frameworks to discuss these things and workshop solutions together. You know, we all feel like we're carrying the world on our shoulders for each individual case. There must be better ways of navigating these things collectively where we're learning from each other. But we're also busy and we're also catching up with a paradigm that wasn't in existence 10, 20 years ago. So I would like to think in my professional role that I can proactively try and work with other people. I'll do it all myself, but to bring some of those things into action.
So part of this is, how do you communicate how we stay human as doctors with all our limitations and offer help to people to stay human with all their limitations? We want to improve it best we can. And I suppose it sounds pretty modest, but I think our big goal is to be helpful, but knowing full well that we're fellow strugglers. Don't think we've got all the answers by any means, but we do think it's important to try to get there with better answers than we were equipped with when we started out on the journey. What we wanted to do was make sure that we were able to reduce the isolation of clinicians and begin to build connections of shared understanding. And so to start with, we just needed to listen.
It's not often in my career that I've sat down with a group of people and shared so much of the struggles we have and the families have. And if we can improve our ability in our struggle, that will definitely help the families. I'm hoping that this project will offer something for the medium and the long term.
Up next, clinicians reflect on the need for and value of peer connection, especially for isolated clinicians.
I think we spend a lot of time together in sort of BT days, like basic training and exam prep and everything. And from advanced training, progressively each year, I feel like we become more and more isolated. The expectations on us as senior clinicians now, or senior medical officers, is that we sort of know everything, and it's harder being more isolated with more expectation. And it's so nice to be able to connect with people and share some of those common struggles.
I love the saying, find your tribe, which is sort of about put out your vibe and find your tribe, which was something we used to say in adolescent medicine. But it's important to be around similar people. That will help give you energy and help you keep going with what you want to do.
I think one of the themes that we've all stressed is how important it is that we've got the support of our colleagues and how we work together. But we haven't really addressed the issue of the lone practitioners, the people working out in the community on their own, who often don't have the privilege of having people around them that can help them when they're dealing with grief and loss.
I think it's really helpful to have colleagues to discuss these patients with and to share the load. And I think it really helps to be able to share with our colleagues our difficulties, because sometimes it can be quite lonely. I really feel for those specialists working in the country that may not have the benefit of that. I think that's something that really does help sustain and maintain.
I think that self-care is really quite important, is that need just to be human, and don't be afraid to show that you're a human within the realm of maintaining professionalism. And that's actually probably the most important thing to do in a consult first, is be a person. Don't be afraid to talk to your friends and your colleagues, and you don't need to hold all that in isolation. Medicine's a team sport, and we do need to seek out others to help us. And there always is the challenge of the siloing, that overcoming that can be difficult, but you got to have friends.
Over the years as an oncologist, I've seen enormous changes, as you can imagine. So I've seen a lot of grief and loss, and it really is a privilege. And I think one's able to support families because of the camaraderie, the collegiality, and the support that we give one another, where everybody can support one another. I think for people who work in isolation, it's very much more difficult.
In the next section, clinicians acknowledge the importance of ensuring opportunities for multidisciplinary team debriefing, connection, and communication in order to support one another.
One of the things that over the years has mattered a lot to me, the medical model and the nursing model have often worked in silos, and with these families and these children, there's an enormous richness and sharing and comfort, I think, when nurses and doctors talk. So there's not always a nurse in the room when bad news is given. It would be lovely if it was the gold standard, but it's not. So the nurse doesn't always hear that, particularly junior nurses. But what those junior nurses do is they're the people wandering around the bedside with all the jobs to do. So families often say things after meetings. You often observe across an 8 to 12-hour period the impact of that. You listen to them talking to relatives, listen to share that with the medical team is really, really important. We cannot work in silos as clinicians. We must work in teams with these families, and we must all be on the same page so we don't create inconsistency.
I think an important thing is that as medical staff, we may see the family twice a day, but the nursing staff and allied health who are on the floor during the day, or our junior doctors, are having to work with the family on a much more frequent basis. And I think that's very important, that we ensure that there's support for everybody when they're dealing with such confronting patients. We understand why they are confronting, but we still have to deal with it. And it's important that there are opportunities to debrief, that there are opportunities to give guidelines as how to best manage it.
I think nurses are pretty good at nurturing. I think they're good at nurturing families, and I think they're good at nurturing each other. But I think what we do have is a safe space, mostly to be able to talk, and we do it often.
Despite the need for and desire for reflection, clinicians in the next session acknowledge that reflective practice opportunities for medical practitioners are often lacking. They note there is much to be learned from their non-medical colleagues and emphasise the importance of cultivating space and time to create reflective opportunities.
I think we've got a lot to learn from our non-medical colleagues, or maybe even not the nursing fellows. I'm thinking particularly about allied health in terms of the training. You look at social work training, and from the undergraduate degree, self-care, managing emotions, debriefing, supervision, that's built in from the beginning in a way that is completely alien in medicine. And I think that there are a lot to be learned from how other professions do it and how they manage the conflict, the distress, the grief as they work through their clinical loads. As so many social workers do very differently to doctor.
So I think that our juniors need space and time, which is really very valuable. And we would never normally have this sort of opportunity to be able to not have anything else on, to really be able to concentrate on how we feel about these things. And ordinarily they wouldn't be able to do that because they're running from cannula to cannula, or, new patient to new patient jobs that they're doing. And so I think if we can cultivate some space for the juniors to be able to reflect on that, and in order to be able to be vulnerable and to give them time to be able to talk.
Up next, clinicians reflect on the critical importance of making reflective sessions psychologically safe.
So how do you make it safe? And it's one thing providing space, but how do you provide safety? Because the worst thing of all is to be vulnerable, expose yourself, and then realise that it wasn't safe.
There are some practices that really make people feel unsafe. If people feel blamed or attacked, if anything they say is weaponised outside of the meeting, it's not a treatment situation, it's a professional support situation. The confidentiality issue is a really key one, and that needs to be negotiated with people, I think, because if people don't feel safe, or they feel it's going to overflow, or they feel it's going to damage something else, talking about third parties in a bad way, it's good to discourage, because generally people need to know that what you do when they're not there is what you do when they are there. Safety is really, really important.
I think one of the things that really worries me about the structures is that a lot of the support comes from people who actually control what happens to you. And so that capacity to be really honest about, what's happened to you and what's gone wrong is really limited, because your career is influenced by the people who supervise you. And I think if that the idea of having separate processes to deal with things when things are getting difficult is really important for individuals, because being really honest as you need to be to support yourself is very difficult if those people are saying, for your career, this is what you need to do.
An important thing that this work has emphasised for me is the richness of diversity in groups. Having clinicians representing medicos, nurses and allied health has shown me how much we support each other and how much wisdom we derive from each other. The other point is that I've thought that doing reflective sessions in units would be very helpful, and I think it often is. But on the other hand, I've seen great richness from clinicians coming from different units and sites even, bringing a freshness, avoiding discussions of, say, unit operational issues, perhaps giving a freer voice in a psychologically safe place. A new energy has come from it. So I guess I've learned that there's not a fixed model.
We end today's podcast with a reflection on the importance of proactively developing culture and the ongoing need to foster mutual respect, trust, and safety in the workplace.
I think setting it up for success is important. And we talked a lot about safety and environments and continuity of relationships and privacy and all those things that come into safety. So I think that's one thing is, and then having it valued that actually this is important as getting your emails done, because it might mean you'll be sustained. We're investing in a long-term place here. So the senior people have to say, this is important, we're doing this over a coffee or a more formal structure, that this is part of the enterprise. And it leads on to culture. But it's got to be practiced and developed. It's not accidental. And it takes ages to get your return on it. But culture is a really important thing. And there's proactive things you can do to develop culture. With mutual respect and trust and safety and putting the time aside and valuing those things and respecting each other through the thick and thin.
That concludes today's episode on the value of reflection and connection. If you're interested in learning more about the research project behind these podcasts, or about hosting Connect, Pause and Reflect sessions in your workplace, further resources are available on the Sydney Children's Hospitals Network website. We would like to acknowledge the ClinEquip steering group led by Professor Annie Bai, including Fleur Leman, Professor Kenneth Nunn, Suzanne Nevin, Erin Beavis, Rachel McLaughlin, Rebecca McIntosh, Doctors Rani Sachdev and Elizabeth Palmer, and the ClinEquip advisory group who contributed to the co-design of these resources. We thank the Manildra Group for philanthropic funding. Thank you for listening.